How to test for Sjögren syndrome, from blood work to eye and saliva tests. When your body turns against its own moisture-producing glands, the symptoms may seem harmless at first: dry eyes, a dry mouth, but they could signal something more complex. That's the hidden danger of Sjögren syndrome, a chronic autoimmune disorder that often goes undiagnosed for years. Knowing how to test for it can change everything. Sjögren syndrome occurs when the immune system mistakenly attacks the body's own tissues, particularly the glands that produce tears and saliva. It often accompanies other autoimmune diseases, such as rheumatoid arthritis or lupus, making its detection even more critical. Early and accurate diagnosis is essential to prevent long-term damage to organs and improve quality of life. The journey to diagnosis usually begins with blood work. Physicians commonly order anti-nuclear antibody (ANA) tests, anti-SSA/Rho and anti-SSB/La antibodies, and rheumatoid factor. The presence of these autoantibodies can strongly indicate Sjögren's, but blood tests alone are rarely definitive. Eye tests are also a crucial diagnostic step. The Schirmer test measures tear production using small strips of filter paper placed under the lower eyelids. If the eyes produce insufficient moisture, it may suggest glandular dysfunction. Ophthalmologists might also use a dye test to check for damage to the eye surface, which is common in Sjögren's patients. Saliva tests help complete the diagnostic picture. A salivary gland flow test quantifies saliva production over a fixed period, usually 5 minutes. A significantly low output raises red flags. Silometry and salivary scintigraphy, which involve imaging the salivary glands using radioactive tracers, offer additional insight into gland functionality. In certain cases, a minor salivary gland biopsy may be recommended. This involves removing a small piece of tissue from the inside of the lower lip to check for clusters of white blood cells known as lymphocytic infiltrates, a key indicator of the disease. Because symptoms often mimic other conditions, the process of elimination is also essential. Conditions like dryeyesyndrome, allergies, or medication side effects must be ruled out to avoid misdiagnosis. Hence, a combination of tests is usually required for a comprehensive evaluation. Early diagnosis is more than just a medical formality. It can mean the difference between manageable symptoms and irreversible organ damage. If you're experiencing persistent dryness or fatigue, it's worth asking, could it be something more?